I knew straight up that I didn't want to be in a big hospital. I wanted people who knew my name and people who cared about me and people that I could work with in a smaller environment. That was what I originally wanted, and that's pretty much exactly what I've got.
I've spoken to a lot of my colleagues down in Adelaide, and I know that the PRCC program is fantastic for just actually getting in there and getting into doing things rather than standing in the back corner of an operating theatre watching the scenario, watching the operation unfold. You're actually there doing it.
Straight away you're expected to be doing suturing and heaps of cannulas and even excisions and all the procedural stuff that you don't get to do as much, I think, in the larger hospitals.
I understand that people back in the big hospitals see some more, I suppose, rare, special stuff. But I figure the day-to-day medicine, you're going to get more of that out here.
I have seen a heap of chest pain, and I've managed a heap of chest pain. I've put in countless cannulas, I've put in heaps of catheters, I've just done the everyday stuff. You know, I saw patients every day.
Out here, you turn up first. You're the first one there, the first doctor there, which is amazing. And it's a huge amount of responsibility and a huge amount of pride when you actually kind of do something right and can kind of put a patient at ease.
One of the most significant things I can recall in my, relatively early days of being here was we had an emergency event where I actually had to practice CPR, and we managed to revive the person, and the patient whom I've had an active role in saving and managing is now had a very positive outcome as a result of the intervention that we've done. And so I think that's probably going to be one of the most memorable experiences for me personally.
When you're actually placed in that scenario where you're seeing patients in a room in a doctor's office, and for all intents and purposes you're the doctor to that patient, you really have to take on that doctor's role, and you can surprise yourself with the amount of knowledge you can impart onto your patients and the amount of good that you can do, even with the limited knowledge that you have.
The doctors really want you to kind of, formulate your own ideas, think of your own plans and put it forward, try and put it into action. And certainly at the start of the year, that wasn't really happening so much really with any of us, just because we were so new and it's our first clinical year. But now you really get to the stage where you make the plan yourself, you decide on the course of action, you tell the patient, they agree to it, and then you run it by the doctor. And generally they're quite happy with it.
Back in the big hospitals, I think you're very low on a long queue of people, and I think you're less likely to get the hands-on experience. And just management of everyday conditions, so the common things like diabetes, heart disease, and the bread and butter stuff that hopefully you're going to know how to manage well for the rest of your career.
Even if you think, oh my gosh, I have no idea, just give it a go, and it's the best way to learn.
I think I'm going away with a lot more confidence. I know I can talk to patients, I know I've got a good grounding in being able to diagnose things that are common or serious. I know if someone walks in off the street, I can do things, I'm useful.
I definitely believe that this is probably one of the best medical experiences any medical students can have, just given the amount of clinical exposure and really just getting the good foundations for what is required for internship and being a resident medical officer.